Hello, I'm Dr. Sindhu, one of treating doctor here today in the clinic. May I confirm your good name and age, please? Nice to meet you, Mr. Fazal. May I know what brings you here today? Mm-hmm. Okay. Mm-hmm. Mm-hmm. Okay. Anything else? Mm-hmm. I'm very sorry to hear about it, Mr. Fazal, and I totally understand it, how the stressful situation is for you. And is there anything else you like to add? Mm-hmm. Okay, Mr. Fazal, in order to better understand your condition, I would ask you a few questions. Is it okay with you? Thank you, Mr. Fazal, for your cooperation. So can you tell me since how long you have been, suffering from pain in your foot bed? Mm-hmm. Is it first time? Okay, if there is any association? Mm-hmm. Any post-meal vomiting? How about your appetite, if it is increased or decreased? Mm-hmm. Any aggravating factors? You think that these things are worsening my symptoms? Any relieving factors, like what you have to take to relieve it? Uh-huh. Have you noted any specific timings? Mm-hmm. Do you think there is any relation with food? Mm-hmm. And any relation with lying down? Okay. Do you have sense of food coming up in your mouth? Mm-hmm. How long after taking food do you feel pain in your food bag? Mm-hmm. Okay. Have you noted any change in your weight? Mm-hmm. And which of foods you think that you take and worsen your condition? Mm-hmm. Okay. How about your bowel habits? Do you have constipation? Mm-hmm. Can you tell me what is the color of a stool? Mm-hmm. Mm-hmm. Do you persistently vomit post-meal? Do you have any swelling or mass in your food bag area? Have you noted? Mm-hmm. Okay. Any previous confirmed diagnosis of stomach ulcer? Any history of surgery? Mm-hmm. Do you have hypertension? Mm-hmm. Okay, Mr. Fazal, I need to ask you a few more questions. Is it okay with you? Will be of personal nature. Okay, so Mr. Fazal, can you tell me, do you smoke? Mm-hmm. How much? Mm-hmm. Are you willing to give up? And that's great. I really appreciate. And yeah, we'll definitely talk about it in the next appointment. Okay. And do you drink? Mm-hmm. How much? Are you willing to cut down? Okay. Mm-hmm. Okay, Mr. Fazal, can you tell me if you are taking any drug prescribed by a doctor or over the counter or any painkiller? Mm-hmm. Okay. Okay, Mr. Fazal, how's everything at home? If you are married, do you have kids? What do you do for a living? How's everything at workplace? Okay. Okay, Mr. Fazal, what do you think that what worries you the most? Mm-hmm. Okay. Mm-hmm. I totally understand. Yeah. Okay, Mr. Fazal, in order to come to my diagnosis, I need to examine you. Is it okay with you? Thank you, Mr. Fazal, for your cooperation. I'll sanitize my hands and let them dry, and then I'll rub my hands, and then I'll ask patient to look up. I'll check for anemia, and look down. I'll check for jaundice, and and I'll check nails for clubbing, and I'll check a neck for any lymphadenopathy. And Mr. Fazal, can you and keep your shirt until your chest so that I can examine your abdomen? Thank you. Then I'll inspect and then palpate. So first I'll inspect for if there is any bulging, any scar, or any swelling, any distension, house breathing pattern, and then I'll palpate in S shape, and then I'll palpate for organomegaly, and then I'll check for ankle edema. And thank you, Mr. Fazal, for your cooperation. You can have your seat, and then again I will sanitize my hands. And Mr. Fazal, the symptoms we have discussed and examined, I have performed. I come to conclusion that maybe you are suffering from what we call it in a medical terminology is dyspepsia. Okay. So for it, I'll strongly recommend you some lifestyle changes. Is it okay with you? Thank you, Mr. Fazal. So, Mr. Fazal, let's talk about lifestyle changes. So, I will strongly recommend you to have healthy diet, okay, and reduce your weight, and try to do exercise regularly, and walk for 30 minutes 5 days per week, 150 minutes per week, okay, whatever is feasible for you and okay. And I'll strongly recommend you to cut down alcohol, okay, to safe limits, and stop smoking, okay, and raise your head end, okay, while sleeping, and I'll strongly recommend you to have meal 3 to 4 hours before you are going to bed, okay, because digestion takes 3 to 4 hours, okay, to takes place. Okay, digestion takes 3 to 4 hours. Okay, so you should go after that the bed. So don't go immediately after you have meal. Okay, and then let's come to the treatment. Okay, if your heartburns and pain did not go with lifestyle measures, then I will offer you tablets, and it is that are proton pump inhibitor. Okay, you have to take with empty stomach for 1 month. Okay, if there will be no response, then I'll perform a test called H. pylori testing, endoscopy. Okay, with the help of this test, we'll try to detect some bugs called Helicobacter pylori in your food bag. Okay, and if the test comes positive, then I'll give you a trial of combination of 3 drugs. Okay, is everything clear till now? And if God forbid, if still there will be no response, then we'll give some other medicines. Okay, and we will use these drugs in low dose and minimum amount to control your symptoms. Okay, or on as the needed basis. Is everything clear till now? And yeah, I'll routine refer for endoscopy. Okay, is everything clear till now? Okay, so Mr. Fazal, can I summarize all again for you? Should I? Okay. Is there anything else you want to discuss with me today? Okay, Mr. Fazal, take good care of yourself. I wish you a speedy recovery. And here is a leaflet. It includes all the information regarding your condition, and I hope it will be helpful for you. Bye bye.